Hello, today is November 12, 2020. My name is Erlinda Amaya. I'm interviewing Maritza Ramos for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Mrs. Ramos, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Okay, so do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library? I think you paused a little bit. Can you hear me?
Hello.
Okay, can you hear me?
Now I can.
Okay. Did you hear like what I said?
I said yes.
Okay. Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes.
Yes. Okay. Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview where it may be viewed by people around the world?
Sure.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes.
As you recall, we previously filled out the pre-interview form. We use information from the pre-interview form to help in research. The entire form is insecure in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions for your consent on what I just described. Okay, do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes.
On occasion, UTRGV Special Collections and Archives and Voices receive requests from journalists who wish to contact or interview subjects. We only deal with legitimate news outlets. Do you consent for us to share your phone numbers or your email with journalists?
No.
Okay. Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview that I will now ask. Okay, now I'm just gonna give an introduction. Maritza, thank you for your time. Like I said earlier, your stories and experiences are valuable.
What happened?
I forgot to do something.
I was like, oh, what happened?
How do I do this? Okay. I want to see if I can. How do I? Okay. I think I pinned your video, but I don't know if I want to do that all over again because that was supposed to be done in the beginning. So I think I'm gonna
It's
do
up to
it.
you.
Okay. I'm gonna do it again. That way I can just stay pinned. That way the video can stay pinned. Okay. All right. I'm gonna read the whole thing again. Okay.
I have to answer again.
Yeah.
Okay.
Okay. Hello, today is November 12, 2020. My name is Erinda Amaya. I'm interviewing Maritza Ramos for the University Library Special Collections and Archives at the University of Texas, Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Ramos, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any other materials you provide?
Yes.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes.
As you recall, we previously filled out a pre-interview form. We use information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes.
On occasion,
Yes.
UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or your email with journalists?
Nope.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions I will now ask. Okay. Maritza, thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives and the Voces Project. Particularly for us at UTRGV Special Collections, we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley and those who work closely with these populations during this COVID-19 pandemic. As their healthcare As a healthcare coordinator, I know that your career was affected due to this pandemic, and I want for future people to understand how the RGB was affected as well. Your perspective and experiences as a mother are valuable so people will gain an understanding of the parent point of view during COVID-19. So I'm going to go ahead and ask you just an icebreaker question. Who is Maritza Ramos? Just share with us like some information on who you are and where you grew up and stuff like that.
Okay. So you want to know who I am and where I grew up?
Yeah, or like anything you want to say about yourself too.
Okay. My name's Maritza Ramos. I'm 40 years old. I grew up, raised and born here in Wasaco, Texas, in the heart of the RGV. I've raised my kids here, gone to school here, got my LPN when I was about in 2015. I am now an LVN and a healthcare excuse me, and a healthcare coordinator for a very well-med insurance company. So
Okay, that's good. That's good. Okay, the first question I want to ask you is when did you first hear about COVID-19? How did you learn about it? Like the radio, TV, news?
TV news and of course work, since we're directly working with patients. Some of our affiliates and everything work like direct contact with the patients, and some of us work in the offices, but we all have to be aware of what's going on with the health care industry. So we learned about it really early.
Oh, okay. What was your first reaction to the information about COVID-19?
It was kind of a little bit of fear, I guess, since I'm a high patient. I've had asthma since I was about 24, and I've been dealing with asthma since then. Just what it does, the symptom of COVID, everything that it caused, it struck a little bit of fear. And not only that, for my kids as well, because I mean, you never know who has it and who contracts it. It's kind of scary. The flu, like they have visible symptoms right away. COVID does not. It
Yeah,
takes a while for the symptoms to show up.
yeah. Okay. At what point did you realize this pandemic was a serious life-altering event? Or do you not think?
Um,
Why?
I think it's a serious. I do think it's serious. The moment that it the way it spread, and the amount of cases that were increased, starting of course on the East Coast and its way over to California. I mean, the numbers didn't lie. And the fact that they started closing down businesses and schools were sending their kids home, and that's when it became a serious thing. When they sent us home, it was kind of scary.
Yeah.
It's very, very.
Yes, it is. Can you share with me what you understand about COVID-19 as an infectious disease? Likewise, can you share with me what you don't understand about this new coronavirus?
I know that this virus starts off in your upper respiratory, as far as like your throat, your lungs, a little bit of breathing, but it also starts affecting your, not only your breathing, it starts affecting kidneys, it starts affecting your general systems. Like it takes a toll on it, because I guess it thickens the secretions. You don't get enough oxygen, and all your vital organs need oxygen to function. And if they don't get enough oxygen, they start breaking down, um and they start shutting down, for that matter. And I know if you have like pre-existing conditions like asthma, people with heart problems, people with lung problems, not just asthma, maybe COPD, the elderly, um, they're affected greatly. I mean, they're the ones at highest risk, because of the fact that it affects your lungs so much, and the oxygen levels go down so low. It's hard to, I mean, I've seen it as far as where I work with. I check on patients daily and make sure that, I mean, they're doing okay. And we've seen the numbers in people that expire increase because of COVID-19. So it's a lot. And what I don't understand about it, I don't understand. I understand if you can get it again. I don't understand. Um, I don't understand what people don't understand.
Okay.
It's contagious.
Yes.
People need to take it seriously, and some people don't.
Yes. Yes. Would you take the first COVID-19 vaccine available on the market? Why or why not?
Um, if it were guaranteed that there wouldn't be any major side effects to it, if it would be that it's guaranteed to protect my lungs and any of vital organ that I have, I would say yes. If I don't, would not, if they can't guarantee those kind of things. I mean, it's an experiment, and I have a lot. I still want to see my kids. Like I don't want to put myself at risk because I stay safe by putting on a mask and staying away from public areas and stuff like that until we know that this vaccine is actually 100% proof that it works against the virus. Sorry.
Does your family hold the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly?
They're they take it like me. My mom takes it a little more seriously, but she's elderly also. She's in her 70s. So she really doesn't like going out at all. We do the shopping for her. Um we go by and take her groceries whenever she needs stuff like that. She's really afraid of going out in public and getting it. Us, on the other hand, I mean, it's a demand that we need to do. We have to go out and we have to do our grocery shopping. Sometimes my husband goes out of town, so I have to do the shopping for us. And as long as I'm taking all the precautions that I need to, then I'm like, it's okay.
For these next questions, they address the effects of COVID-19 on your personal life and your work life. Just for some background on you and your family, how would you describe the relationship you all have?
I'm sorry, repeat that.
Just for some background on you and your family, how would you describe the relationship you all have?
Oh, as far as my immediate family, my kids, my husband, we're all pretty close. We spend every day together. We go outside. We're usually hanging out. My kids are always fighting, usual sibling stuff. But all in all, we're a pretty tight group. We don't leave each other. We go to the stores together. Um, we're pretty tight. As far as my mom, she stays at home. His mom is very close, but she lives close by, so she comes over every now and then. Other than that, the other families we see once in a blue moon.
How did you and your family first adjust to the quarantine that was issued in March?
My husband took leave, and he made sure to be the only one to go out in public and get the stuff we needed. He was the one doing all the errands for us and for his mom and for my mom. And as far as us, we stayed home and abided by it. We didn't go places. I hardly even went over to a friend's house. Knowing that we were negative, we still wouldn't see each other. And until even now, we hardly go out as much as we used to. Like, it was almost 3 times out of the day we'd be at one of the stores, Walmart, HEB, somewhere, and now it's maybe once a week we go, maybe if that, once every 2 weeks. So it's changed a lot, and like, we still adhering to it. We don't have big gatherings. We don't I mean, we do go hang out at a friend's house, but we make sure that nobody's sick, and if somebody's sick, well, then we'll just cancel everything altogether.
How did your kids react to there being a cancellation of school, and did this present any challenges for you and your husband, as far as taking care of them or finding someone to take care of them?
in the very beginning, it was challenging because they were on spring break when it happened. So after spring break, they were supposed to have returned to school. And since they didn't, it was, to them, it was like, ooh, a longer vacation. Woohoo. But for us, it was like, oh, dang, who's going to help them with their school? What's going to happen? How is this going to work out? I was lucky that my daughter stayed home for this semester, and she helped me out by helping them with their work, taking care of them, feeding them for me while me and my husband were still working out in public. Um, so she helped us out in a big way. But once they sent me home, I stayed here. I stayed here with my kids, made sure that they got their schoolwork done, stuff. It was an adjustment for them. My son loved it because he everything electronical he's good at. So learning online for him is easy peasy. For my other two, well, it's not. They're more hands-on. They need the classroom setting. So for them, it was an adjustment.
Yeah.
Other than that, we're still here. We're managing. So
Can you share with me stories about how COVID-19 has changed your family's gatherings for birthdays, holidays, or vacation travels, if at all?
In travels, we have not vacationed because of COVID. We're not gonna take the risk of going out into. We usually go like up to San Antonio, up north to New Braunfels area, take the kids to Bean, stuff like that. Occasion, if we can, we'll go to California or Florida, take them to like Disney or Universal. But we're not even looking into that right now. As far as gatherings, I'm lucky so far. We haven't had any major gatherings for now. We got to have the kids gatherings before, and now, like my 12-year-old, I would usually planning for like a quince for her, since we live here in the RGV and our Hispanic heritage. Like we celebrate with a big old and a 15, and I started like 2 years before planning it. And right now, I'm not even. The only thing I'm looking into is buying her dress and making just pictures. And whoever wants to drive by and celebrate with us, they'll celebrate with us. That's all I have for now. Like I want people over. I'm not gonna risk being sick over like a little party. If they want to wish her well, they can come by here. Any birthday parties, they can drive by. Everybody's been doing it lately.
Yes. Did anyone outside of your immediate family contract COVID or pass away from the virus?
Outside of my immediate family, I would say yes. We have friends. Well, not friends. My mother-in-law has about 4 friends that passed away from it. My mother-in-law did contract it, but she has friends that gave it to her. And the two that gave it to her, they passed away because they had issues, like they were diabetic, and another one had a heart condition. Another friend of hers also passed away, and it was, I don't know what was wrong with him. He was like in his 50s, 40s. He wasn't even like elderly to say that he was like my mother-in-law reaching the 70s or anything. He was like pretty young in his 50s. He passed away. It's just, I mean, as far as my family on my side, thank goodness we haven't had anybody like say that they've passed away at all. I think everybody on my side of the family has been keeping safe for the most part.
You mentioned that your oldest daughter contracted COVID. How old is she? How did you know she was sick? What symptoms was she showing? And when did she get sick?
She is 18. Right, yeah, she's 18. She's 18, and she really didn't have symptoms. She really didn't have symptoms. The one morning she woke up, the night before, she was telling me that her throat felt sore, like she just had like a raspy throat feeling. The next morning, she woke up, checked herself for a fever because she was feeling more cold than usual with the aircon. So she checked herself and it was at a 102. I wasn't going to take the chance. So I sent her straight. I told her and my husband, take her to the doctors, take her to get tested. Excuse me. We took her to two places. One of them, a 3-day check. It took about 3 days to get the results. Another one was a rapid test one, which means they got the results within like 20 minutes. She didn't display symptoms throughout the whole time that she was sick. The only thing she complained about was like congestion in like her sinus and her throat area. No cough, no fevers, thank God. It was just that one time. No, no shortness of breath, nothing. But I moved out of the house because of it. I don't know where she got it. I don't know. I can't say because it was only her. None of us were positive. None of us were positive, thank God. Her friends, none of them were positive. Everybody was good. So, she got it. We have no clue. What, where, when, nothing.
How did you mention that you quarantined away from her? Can you describe that? Can you describe that process, what you did, where you went?
It kind of, sorry for the language, but I had to leave my daughter. I'm usually the caretaker of my kids when they're sick, but with this, I wasn't going to take a chance, and my husband definitely didn't want me to take a chance. So the minute we found out she was positive, my kids packed up their stuff, I packed up my stuff, and we went to my mom's house. She has an extra spare bedroom. We stayed with her for about 3 weeks. Stayed there for about a month until my daughter tested negative again. I had to move at this time I was already working here. So I had to move all my work, my laptop, my display screens, everything. I had to move it all to my mom's house. My kids and I were staying over there. We adjusted to a little bit of kind of life because my mom, she has her routines and we have to abide by it. I didn't know how my daughter was doing. She was quarantined in her room for 3 weeks straight, not coming out, just going to the bathroom, going straight back into her room. But my husband did a really good job of like sanitizing everything. After she touched anything, he sanitized. He wore his mask around her all the time. Thank God she got out of it good. After it took her a month to test negative. Once she tested that last time, I said, I can't anymore. Like, I have to go home. Like, I had to come back to my home and deal with taking care of her. I took all the precautions when I came back home. I made sure until she was completely negative and made sure that, we wouldn't go down that road again.
What effects did the isolation away from your daughter and husband have on you and your younger children? What effects did it have on them as well?
As far as us, I guess because my little ones, it kept me busy. I exercised more because of it. My husband tried to keep himself busy here, going outside and working on his plants. The one it affected the most was my daughter, the one that was infected. She realized how lonely it would be to be stuck in a room for 3 weeks. She broke down one day and told me, she's like, Mom, like, this sucks. And she's not a very touchy feely person, but she realized that she was taking the company for granted, like being in somebody's company. She took it for granted, and she broke down and she's like, I just hate this. I can't be by myself all this time. And she's like, I don't know what I'm like. It hard, and there's nothing for me to do. And that's because we would get her like coloring books. The adult coloring books, of course, and the puzzles and painting and just keeping her busy. But it wasn't this. She's like, Mom, it's not the same. Like, having you in the same room, like talking to you, is so different from being by myself in a room. She's like, not having any physical contact with anybody. So it affected her a lot, a lot, a lot.
Um, Can you tell me a story of what it was like to get tested for COVID? Where did you go? How long was the wait? Did you need to take extra documents in order to get tested? Did you have to pay for tests?
We paid for some tests. The rapid ones that we took, we paid for those because they were rapid, and they said, well, you're getting them within 20 minutes, so it costs so much money. You don't need insurance, this and that. We have insurance though. The first ones that we took, man, we thought they were when they tested us, they went there like not like the flu shot. It hurts so bad, like you feel it in your eye type of thing.
Mhm.
But that one, the first time we took it isn't as bad as the last time we took it, which was closer here. And that swab was a little bit thicker. And man, did those ladies go in. Like, I'm mad because as a nurse, I mean, you want to get an accurate result. You want to get like the correct information.
Mhm.
But man, those ladies had no shame. They went like and hit your brain almost. It's good though, because I mean, you get accurate results like that. Like as a nurse, you know that if you don't get far enough in there and don't get enough, you won't get the accurate results. You'll get a false negative, a false positive, like you don't know. So I mean, it was good, but man, you felt that for like an hour later, like bad. And like I said, for the rapid one, did pay for, but only because I mean, we would get our results within within 15 to 20 minutes. We got our results. And then the the other ones, the 3-day ones, we didn't really have to pay for those. And sometimes like the last ones, like I said, for those we didn't have to pay for it, and we got our results within the next day. It didn't take the whole 3 days anymore. It was just a 1-day wait.
Did you go to like a local doctor's office or your doctor's office to get tested?
Uh, Not my doctors. The kids' doctors weren't doing it either. We had to find other resources. The first one we went to, Feria, that one is my husband's doctor. We did go to his. They were doing it. The rapid was in McAllen, but it was at a pharmacy. They were the ones offering it. And then the last one that we did was through the UTRGV clinic here in Mercedes. They were the ones that they didn't charge us either, and they were the 1-day one. But we had to go to different places and different locations to get all these tests done and making sure my daughter came out negative.
How long did it take for her to test negative?
It took about a month.
A
It
month.
took a series. I think she tested about 3 different times, and it that the final, the third time, the after a month is when she tested negative.
Um, can you describe what you do as an LVN and healthcare coordinator? These are questions
As,
focusing on your job.
as an LVN health coordinator, um, I'm lucky to work in an office. Before that, I was working out in the field. I was a home health nurse before that, but I was direct contact. Now I'm not. I'm in the office. What I do is I call my patients through telephone. I ask them how they're. We get a list of who's discharged and when they were discharged, and we find out how they're doing, making sure that they filled out their medications from the hospital's prescriptions. If they need home health, if they need any kind of medical equipment, if they need an appointment with their primary care physician, we set up those appointments with them. We just make sure their well-being continues after their hospital visit, only because there's a lot of patients out there that even though they come out of the hospital, they tend to go back in maybe within a week or so, but because they don't have like the necessary medications, they don't have the necessary help for
Mhm.
care or for stuff like that. So that's where we come in. We call on the phone, make sure that they get everything they need, make sure that doing fine. And if they have any symptoms of like that they're getting sick again, we call the doctor right away, set them up with an appointment, so that way they don't go to the hospital. They stay like they handle it in the clinic, in the doctor's offices.
What are some difficulties you experienced in your transition to working from home? What were some benefits, if there were any?
The difficulties are the distractions. In an office, you're in an office, you're in a cubicle, you get to do your work and you're on it all day long. Here at home, my kids are on, like, Mom, I need this. Mom, I'm hungry. Mom, I need help with this question. Like, it's a kind of a distraction from my job. The benefits are the fact that I'm here with them while they're doing their schoolwork, because I get to help them if they need anything. Like, if something's not working, it's not connecting right, they need have a question on their schoolwork, I can help them. If they need anything as far as, like, I don't know, like the science for my son, they ask him to do little, like, projects, like to make slime and stuff like that. If we have the materials, I get to help him, like, get it all together. Like, it helps in one way, but in the same way, it's kind of a distraction from my job.
From your work, yes.
Yeah.
Do you know when and if your company will open and allow employees to go back to work?
They're slowly transitioning back to going to the office. As of right now, I think they've had half of the employees go back already. Right now, what is being said is, like, as long as we stay productive at home, we probably won't go. We'll probably be one of the last ones to transition back into the office, especially because, like, I believe three are high risk. They don't want to. They don't want to have us out there and then something happened to us only because they want us to go into office. If anything, they're shooting for late December to try, but aren't going down, so I don't think that's gonna happen.
Do you know if any of your coworkers were let go because of COVID-19?
No, none of my coworkers were. Most of us, like I said, we transitioned to home. We're still doing our job from home. Um, I know for a while the direct patient contact ones, like the ones that work in the clinic, they were told their hours were cut, but because the doctor's offices weren't seeing the patients for a while, like face to face, so they didn't need as much staff in the offices. I know they're slowly going back because the doctors are starting to see the patients again, but if anything, it might have slowed down a little bit, but most of us, thank goodness, I think because we're medical workers that work from home, I think we haven't had to lay anybody off or. Mm-hmm.
Did they cut any one of your coworkers' pay?
No, we're all still the same.
How do you feel about the people in the RGV's overall response to the pandemic?
Mm-hmm. I think it's a little irresponsible of a lot of RGV people. I don't. I want to say it's either lack of education or lack of caring, but they didn't take it seriously to begin with. I mean, even in my own neighborhood, we saw people having parties when the pandemic was at its highest, and no masks, social distancing, no adhering to the Hidalgo County rules or anything. I mean, it's just lack of education and lack of caring. I think everybody should have taken it seriously. I think when they take it seriously is when somebody directly related to them is involved. And it's sad to say that that's what it takes for somebody to open up their eyes. But I mean, it's that whole Mexican machismo, like, you're going to tell me what to do type of attitude. We're going to do what we're going to do. No estoy malo. Like, I'm not sick type of attitude. Like, I can beat it. I mean, you don't know how it's going to affect different people. I really wish people would have taken it seriously. We wouldn't have been a hot spot. We wouldn't have overworked our frontline nurses, our doctors. We wouldn't have overworked them in the hot spot, like in the time when it was like really bad. I mean, it's just, they need to understand that it's not about them. It's about everybody as a whole. And they didn't take it seriously enough.
Did you report any of your neighbors? Was there any cops patrolling the area that told him stuff, or they just continued?
That no, we didn't report anybody. The cops, the no, nobody patrolled. Nobody said anything. We live kind of out of out of city limits, so we get what who we have here is like the sheriff's department, but it takes them forever to come around, and it's just a matter of, oh well, like, hey, that's your life, you're the one risking your life. And it's not that we look the other way, it's just that we're not involved.
Did you go to any grocery stores to stock up on food? If so, can you describe to me the shelves and the overall attitude of the people inside the store?
In the beginning, like I said, my husband was the one who did it, but he's the one who said that there was nothing, that the shelves were bare. No toilet paper, I don't understand that one, but no toilet paper, no disinfectants, no like essential stuff that we need for the house was missing. People, I mean, I guess they panicked, and I understand why, but um as far as when I started going to get groceries, there was a point where there were no meats in the grocery store. When I started going to the grocery store, there was no meat at one time, and I mean, it's just crazy, like, to think that the shelves can be empty because of so many people stocking up and afraid to be out in public for so long. It's scary.
Do you feel that stores and businesses have good social distancing policies here in the RGB?
No, no, they don't. They try to. HEB tries to really well. I mean, they have their markers on the floor. They try to social distance people. Um, but as far as, I mean, the people themselves, they don't adhere to it. But there's nobody there telling them to, like, ma'am, you need to, like, stay on your marker. Don't get close to. I mean, that's when communication happens. I mean, myself, I had to tell a couple of people, like, can you give me space, because you're not within 6 feet of me, you're within like 2 feet of me, and I'm not comfortable. And they get all attitude about it. But I mean, it's a matter of telling them. Walmart, I mean, people are walking by each other left and right. There's no social distancing, like, adherence. And of course, I mean, you can't have workers on everybody. It's up to us to want a social distance. It's up to us to adhere to those rules. They can't be, we can't be taking care of like little kids. Like, we have to be adults about it. And it's just, I mean, people don't care. People don't listen to the rules. People don't, I mean, they're like, oh, well, I have my mask on, it's okay with that. No, like, before that, you were probably touching your face, you touch the items, like, you're just, you don't know.
Mhm.
And as much as the businesses try, I mean, there's so much they can do, and it's up to us. Like, it's up to us as adults.
Your video froze.
Hello? There you are.
Okay, yes. Okay, can you repeat what you said? It like stopped. I couldn't really
Oh,
hear.
okay. Yeah, like, I mean, like, I like, as much as like, as much as they try to keep us distanced, it's up to us. It's not really, I mean,
Mhm.
babysit us like children. We have to be adults about it. We have to be the ones to social distance ourselves. Um, like I said, in Walmart, they're walking back and forth. There's no like markers telling you like anything. Not gonna be on top of you, like taking care of you like a child.
Mhm.
And even in the line, I mean, I want to say, even at registers, academy, like, they have the new setup, but they have registers open side by side, so when you're paying, you're really side by side next to somebody. You're not 6 feet away from that person. So it's just a matter of, they have to it in front of them, and it's up to us to adhere to the rules away from the workers. Like, it's up to us.
Are you satisfied with the local response to COVID-19 in Hidalgo County? Are you satisfied with the state response to COVID-19 led by Governor Abbott?
I'm not, actually. um but then that is my opinion. I understand that the economy is important. I understand money has to be coming into all these businesses. If not, things will shut down, economy will go down. But if they would have responded with shutting things down, just shut it down for 2 weeks, complete shutdown for 2 weeks when the pandemic was at its hottest, I think there would have been better control in every location, not just in the RGV. I think in the RGV, the clubs should have shut down. I still think there, I mean, it should still be at 25% capacity, in my opinion.
Mhm.
Like, you're still bringing in some business, but they're not. They're at full capacity sometimes. They're at 50% capacity, some restaurants. I mean, like I said, you have to walk by people. You're still making some kind of contact with these people. I mean, sitting down 6 feet away from somebody, it doesn't matter. It's still in the same area. How do we know that everything's getting disinfected? Or, like, there's no guarantee. I think when the pandemic was its hottest, the governor should have shut down everything. He should have made it mandatory. He should have made an absolute rule because, like I said, not everybody acts like an adult and does the right thing.
Mhm.
Everybody is like, oh, well, it's not required to wear a mask, so I'm gonna go out and not wear a mask. That was the attitude of a lot of people.
Mhm.
It was like, oh, well, it's not required. I'm not gonna wear it. You can't make me. And that's when it spread. It spread like wildfire when people were not wearing their masks. I mean, you start seeing the numbers go down, but because the masks are on, like, businesses are now requiring that they wear them. So no, I don't agree to the response that they had. They took it as a joke and, oh, we'll get over it. It's just a small virus. No, this is costing the lives of the elderly, costing the lives of people that are high risk. Like, it's not just about you and your money. It's about, like, the human race in total. Like, I don't know. It's just my opinion. Sorry.
It's okay. It's okay. Um, are you satisfied with the national response to COVID-19 led by President Trump and his administration? You can elaborate on why or why not.
No, he should have been on top of it from the minute he heard about it. Um, he should have took the reins and took control. I mean, this is his country. He's the president. He should have led by example first. The fact that he was out in public without a mask on, that told everybody that it's okay. Like, I don't have to have a mask on. His own supporters, I mean, they still went to rallies and no masks on, no social distancing, no, I mean, what kind of message is he sending out that this is nothing? No, like I said, I mean, it's cost the lives of 200,000, 200 million, what it is. But those are people, those are somebody's family member, that's somebody's mom, that's somebody's dad, that's somebody's brother, sister, whatever. That, like, you don't, if you take one life for granted, then you're not a leader. If you're not responding to the way it should be. Like, how is it that we have the most cases in the US when we're supposed to be the top nation in all of the world? And yet these third world countries, these small countries, China, Japan, all of these got control over it. Like, you're not doing something right. Your leader isn't telling you to do what is necessary to control this virus. I mean, it reflects on the leadership, and the leadership was just, like, what do you call it? Late. It was just, yeah.
If you had the power to respond to COVID-19, what would you do differently, if anything?
To respond to COVID-19,
If you had the power to respond, what would you do differently?
if I had, as soon as I would hear about it, wherever it may have started, I mean, you have your advisors, you have people that tell you, if as soon as you hear about it, start working up a task force to make a vaccine, to write down rules and like enforce them. Tell law enforcement, this is what needs to be done. Wear a mask, do this. We need to shut this virus down as soon as it happens. get multiple companies to do a vaccine, because you never know. It's like a race to get to the finish line. You want to get rid of this thing. I would have, like I said, I would make it mandatory from the very beginning for everyone to wear masks. I would make it mandatory for businesses to 50% capacity or less. I would have made it mandatory to every business has to have stations where they can sanitize, and it must be filled every single day, like an hourly basis, on a 2 hourly basis, like stations where you can just sanitize your hands, make sure that nothing is, like disinfectants everywhere. But that's something, I mean, that should have been done, in my opinion.
This is a special year in our national democracy because it's a presidential voting year. Did you vote? And if so, did you notice or do anything different because of the COVID-19 pandemic?
I did vote, and the only difference was in for me, the only
Mhm.
difference was in the manner of voting. Like my mom, I did the in-person voting. My family, a couple of families did the mail-in voting because of it. Um, but as far as anything, mine stayed the same. I still took the chance, and I masked up, gloved up. They used like little things that you're not touching personally to vote. So I took that chance. It was too important not to vote this year.
Do you see there being an end to COVID-19 in, let's say, a couple months from now? Or do you think this will maybe continue for another year or so?
Honestly, I think it's going to continue for another year or so. I don't see it ending in a couple of months.
And why? Just why?
Um, Same thing. People aren't listening. People are taking it for granted. It's just a matter that they're not taking it seriously enough.
Is there anything new that you have implemented in your life to take up some of your quarantine time? For example, any new hobbies or anything that you've done to keep yourself busy?
I have exercised at home more. That's one hobby. Like I'm walking on my own, not in any personal, not at a park, not anywhere. Here in my neighborhood, I take a walk, and we've gotten into a lot of painting, a lot of music lessons and stuff, that kind of thing. But yeah, me and my family, that's what we're doing to stay busy: puzzles, painting, walking, and of course my kids game. They've gotten real into gaming.
Do you believe that with the new president-elect, Americans will see a decrease on COVID cases and activity?
I hope so. I really do. I mean, I'm gonna be honest and say that I voted for him, and only because the response from the president now wasn't good enough. So I'm praying that this man gets it all together. This new president elect gets it all together, and shows the world that it can be done. Something can be done, and it can be done today.
Would you like to share just any final thoughts, any stories about COVID? Or
Um, as I'd like to say this, as a person who family member was with COVID, I'd like to say that we got lucky. We got very lucky. Um, we got very lucky because it was just her that was infected, and thank God every day because it didn't affect all of us, and it wasn't a hard effect either. It was the minimal you can get, the minimum symptoms you can get. She dealt with it for the whole 4 weeks without losing her breath, which is great. But as a nurse perspective, like I said, I'm still working from home, and I still talk to patients, and I hear their stories. And they uh, yesterday, a lady I spoke with said that she contracted COVID back in um, September, and she's still dealing with symptoms today, like to today. She's still having a hard time breathing. She was one of those that went into the hospital, came out, which was great, but she hasn't fully recovered. She's still dealing with shortness of breath. She can't walk in her own living room without having to use the oxygen. She can't do her daily activities without losing her breath. And she says that it's horrible. She's never felt anything like this before. And I really, really do want to say, like, as far as us, we can't take it for granted. We can't take breath, our breath for granted. Like it's we may think they're young and they say don't get affected, but you may not get affected, but your grandmas do and your parents do. And like if you got older family, they do. And I think you want to be responsible for infecting them and getting them sick to the point where they might even pass away. Like it's just hard hearing the cases that I talk to. It's hard hearing my patients go through this stuff. It's hard.
Thank you. I think that's about it. If you have anything else to share, or if you would like to share.
No, that's it.
Okay. Thank you for your time.
You're welcome.
Thank you.
Thank you. Bye.